Hi everyone, I am going to be doing an interview today with my colleague, Dr. Keith Berkowitz. He is a medical doctor and an internist. He works in New York, and him and I have been working together for about, we have worked together for I think 10 years now. And together we've been working with patients, looking at the root cause of why somebody has hormone imbalances. So this is how a medical doctor and a naturopathic doctor can work together effectively. So this is exciting. I'm having him join us today. He's going to come on in just a minute once he figures out how to do this Instagram thing. I kind of had to walk him through it earlier. He's a good doctor, but I think the technological aspect of things I'm working on with him. So he wrote this book called The Fat Fix, The Stubborn Fat Fix, which is a interesting book. And he also worked with Dr. Atkins in the 90s. So that's where his passion, sort of came from diet and the low carbohydrate diet, and sort of how that low carbohydrate diet then transformed into him really understanding about blood sugar balances and diet and lifestyle. So that was really exciting. So Dr. Keith Berkowitz, are you joining us? You know how to log in. You just have to click on the request to join and I will add you in. So what we're going to be doing is we're going to be doing a lot of questions and answers at the end. So if you have any questions, please, send us a question and we will answer your question. All right, let's see where he is. I'm gonna find out, see where our Keith Berkowitz is. And let us know, if there's anything in particular. Here we go. I'm gonna get him on. Here we go. Joining us is Dr. Keith Berkowitz, and we will zoom him in a minute. There you are.
Oh my God, this was the hardest part, is actually the technology.
This is my first live interview, and of course with my friend and my favorite doctor, Keith Berkowitz. We work a lot with the patients. I was just talking about you, and we were just saying how you wrote the book, The Stubborn Fat Fix, and how you were working with Dr. Atkins back in the 90s, and how that's where I guess your passion for diet and lifestyle, and then you open up your own center. Just tell us a little bit about that.
Well, the good news, you said my book, The Stubborn Fat Fix, not The Completed Idiot's Guide first.
Oh, yes,
my other
yes.
book.
That's your other book, right.
So my history goes back to, I actually trained as a hospitalist back in the 90s, and I got the opportunity to meet Dr. Atkins in late 90s, early 2000s. And I was lucky enough to really start to work with him and learn a lot about integrative medicine, which was a whole new field for me. And something we'll talk about later with vitamin C. The reason I went to join him is because I saw two patients with cancer who both told me that their doctors told them they were going to die within 6 months. But that was 10 years ago. So they had survived over 10 years doing integrative health treatments. And that was like, oh God, I got to learn this. So I left the hospital and then went to work for him. And then soon after opened my practice. But my practice didn't really explode until I met Dr. Nigma and learned a lot more about naturopathic medicine.
And I learned so much from you, and it's really fun because we get to bounce things off of each other. And, we've been working like this for 10 years now with patients. So we have patients between New York and Los Angeles and London and the Middle East. And we've worked on patient cases together. And I tell you, it's so nice to have two heads on there. And, I wouldn't say our perspectives are different. I feel like we're quite similar in the way we think. And so I just wanted to talk to you about naturopathic medicine and conventional medicine and how we can bridge it together and what your thoughts are on that.
So the thing I learned the most of working with you, I learned that actually you have to look at the root cause. My training really focused around starting from what I call top bottom. We would take symptoms and make a diagnosis based on symptoms. So in essence, we put a Band-Aid on. You know what happens to Band-Aids? They break. So we would never really fix the patient. I always joke when I was working in the hospital, it was mostly managed care. So if I had to give people their money back, it wouldn't be that much. So, but later on, working with Dr. Nigma, I really learned about the root cause. By really looking at what's underneath, you can really solve problems. And what's interesting is many problems share the same root cause. So no matter what kind of condition you're, treating, the root cause may be the same. So if you build up what I call a strong foundation, people often get better and have health that lasts a long time.
Totally. And we see that with our patients all the time. And I'll quite often talk to you and you'll say, well, did you look at their blood sugar? Did you look at their insulin? Did you look at their hemoglobin A1C? Because blood sugar is like a huge, and I think that's where you're kind of like the king of blood sugar. And it's so interesting how blood sugar and hormones and immune, everything is connected. So I know what I really want to ask you today is what you and I have been talking about every day since the COVID-19 crisis. We've been literally on the phone every day. Dr. Keith Berkowitz has been, he's contacted anywhere from the governor of New York to the mayor to, anyone who will listen to a protocol that he's been able to speak to another doctor, a pulmonologist in East Virginia, and get amazing protocol together in terms of like a prophylactic one, a treatment, and actually one when somebody's in respiratory distress. Can we go over this protocol and just sort of talk about the combination of using vitamins and conventional healthcare models and why we're doing that? Because I mean, you and I both know why, but it'd be really good for the audience to understand why things like vitamin D, zinc, and are working, and thiamine and melatonin are necessary, and is how this virus enters the body. Let's start with that. Let's start with what you and I talked about this morning, the ACE2 receptor, and how this virus, those spikes in the virus, get into the body.
That was one of the most confusing things I've ever read. So it took us a while to understand it. So it turns out the virus enters through what we call an ACE2 pathway. Many people have heard about ACE2 from a blood pressure standpoint. Two of the most common blood pressure pills are what we call ACE inhibitors and angiotensin receptor blockers. So one of the mechanisms for blood pressure control is using an ACE2 cycle. The good news for women, they have more ACE2 than men. So actually, we think that women actually have lower mortality levels from the coronavirus 19 because of that. The coronavirus is really interesting. It's what was the word you used? You used a great word before. Sneaky?
Yeah, it's a very manipulative and sneaky
manipulative.
virus.
That's the one. So what turns out is it tries to find ACE2 sites, and it binds to that, and then it actually enters the cell. What's interesting about that, ironically, the more ACE2 you have, the better off you are,
which is women
kind of
mainly.
counterintuitive to what we were talking about before. So what happens is women, because they have higher ACE2 levels, they actually are more protected against the disease. So what happens is it tries to grab all those ACE2 cells and actually find its way through ACE2 cell receptors into the body. From a medicine standpoint or a supplement standpoint, what's interesting is vitamin D actually can be protective. So interesting enough, the only reason I found out about this is I was looking for how controlling blood pressure. So the only studies on ACE2 were blood pressure control. And I learned something new. Dr. Nigma probably already knew this, is that vitamin D actually increases ACE2 levels.
Yeah.
And that's the key at the end of the day. The problem with that, though, is they tried supplementation with vitamin D in high levels. It didn't really work. So it turns out, and this is not surprising to people that look at the root cause, is that you need vitamin C for vitamin D to work. So the point is that we have a system that is all dependent on each other. So one deficiency in any nutrient or vitamin or mineral is going to impact throughout the line. I like the model of Amazon, right? You have a transporter belt. Any kind of defect in that belt leads to the whole system breaking down.
Absolutely. And I also look at it as a symphony of vitamins. Vitamins always work together in harmony, right? So,
correct.
Vitamin C helps absorb iron, for example. Vitamin D and calcium and magnesium are necessary together. So it's more like a holistic approach when you look at supplementing with vitamins and minerals.
Absolutely. Because remember, you want your body to work optimally, and that's the key, no matter what the condition is. And that's the interesting part. The same nutrients work all over the place.
Right.
And I think that's what we're learning more and more. And that goes back to the root cause. You're supplementing across the board so that the whole system works in sync.
So in terms of if people have, can we go over how a lot of people are asking me, okay, so what can I do, just prophylactically, what can I do to prevent this, or, what can I do to keep my immune system strong? And for those viewers out there, we are not your doctors. We don't know your particular situation. This is just a protocol that we have read and how we understand it from our clinical practice. So this is just information we're getting from research that we're putting it out there. Every situation is going to be different, but generally speaking, the preventative, what supplements can people be taking at home safely?
So let me give you the genesis of how it came about, because I think it's important. So there is a doctor, and Dr. Paul Merrick, who's critical care attending in East Virginia Medical School, actually ended up calling this Dr. Mao in Shanghai 10th Hospital. And what he found out, he had treated 50 patients with coronavirus 19, and the amazing part is mortality levels were 0. And so he tried to figure out what supplements and how they interacted and how they work and how can you protect themselves. So if we go one by one, of course, we talked about vitamin D first, right? Vitamin D is critical because that really helps you stop the virus from entering the cell and overtaking the system. The next one is really kind of interesting, is zinc. Zinc actually stops what we call viral replication. So that's how well the virus multiplies. What's interesting about that, I know people have been reading about hydroxychloroquine and Zithromax, as partial treatment options. Guess where they work? They work on the zinc pathway. They actually work by increasing zinc levels in your body. So interesting enough, there's your, again, conventional medicine and, natural medicine or supplements work hand in hand and synergistically to create an effective treatment protocol. And
zinc reduces viral replication. So, that would be the mechanism of action, perhaps.
Correct. And one of the other thoughts about zinc, it may also help with some of the gastrointestinal symptoms that do come from COVID-19. The next one is actually quercetin. Quercetin is really interesting. I've learned about this for years. Where I really learned about it is when people were talking about HIV and hepatitis, that it actually had an ability to lower viral load. And the reason it does that by suppressing something called heat shock proteins. And quercetin is kind of interesting. It's the skin of a fruit. So, and that actually is another effective thing. The next one they've kind of looked at is, and the one actually Nigma taught me the most about, is melatonin. So melatonin not only helps with sleep. I mean, I use it a lot because I found it helps lower cortisol. And especially right now, I'm not sure there's no one without high cortisol levels today.
Well, they did some research on melatonin, and we're not sure if it's endogenous melatonin levels that helped, were protective. But we also know that pregnant women have higher melatonin levels. So maybe that could be some of the reason why we're not seeing as many pregnant women affected.
Well, Dr. Merrick hypothesized that it's actually an age-related thing. So if you think of pregnant women, they're going to be in the under 40 group in general. Right. So he really feels that as we get over 40, our melatonin levels really start to drop dramatically. Right. So that may be actually giving, in a sense, a better opportunistic environment for this virus. Right. Okay. Makes sense. And then the last one is vitamin C. I shouldn't forget that one, right?
I'd marry vitamin C if I could.
I think every patient is now telling me you can't find vitamin C on any shelf right now.
It's out everywhere.
So vitamin C is really kind of interesting. So it's in two forms where it has an impact. It actually is really critical for the immune system. There was one study that was done in mice, and what they did is they took vitamin C away totally. And they said, okay, how did this mice actually now protect itself from infection? When they measured what they call neutrophils are the white blood cells that help your body fight infection, the levels dropped from 100% to 12%. So you lost a lot of that immune response to be able to fight off infection. What's also interesting in critically ill patients that end up in the intensive care unit or even on a ventilator, they can show 80 to 90% of them will have low vitamin C levels. The hard part is, and what we're learning, is that vitamin C orally doesn't concentrate enough to treat, that you actually really need high doses, and unfortunately it has to be given intravenously.
Yeah, and every 6 hours, according to this protocol.
Correct, exactly, because they find that, again, one of the problems, and again, we'll talk about inflammation in a second, inflammation causes a dip in vitamin C levels.
And it's almost like a primer in a way. It allows for the body to reset, to allow for the drugs to work properly.
Absolutely. One of my favorite studies, which has nothing to do with this, there was a study done about 5 years ago on brain tumors. And what they showed is they gave radiation, and then they gave vitamin C and radiation. The interesting part of the study is that when they gave the vitamin C, the radiation was actually able to penetrate the cells, where without it, it didn't work. What's also interesting about vitamin C is steroids. Steroids and vitamin C tend to have a synergistic effect. And again, of course, you want to be careful in any virus to give steroids, because steroids can increase replication, but in the very, very sick, what I mean by those that end up on a ventilator or end up in pulmonary failure or respiratory failure, those are the ones that may benefit from steroids, and they work together.
So do you think vitamin C can be used effectively in hospitals right now with really, really sick people? What would be because I know you've worked in hospitals before. I know you've worked in, you work in New York, you work in Manhattan. Like what would it take to get something like this put into the system now? Is this, I know you're reaching out to everyone. You're
right. So I'll start off, I'm actually a recovering hospitalist, which means that I actually work full-time taking care of patients in hospitals. That was my first part of my career, about almost 20 years ago. So right now it's actually being used in multiple centers, where we're seeing it as in East Virginia, in a hospital in Houston, University of Wisconsin in Madison, and Northwell, actually the place I trained, in Long Island and in the city. So it's starting out. What we're trying to do is actually increase the amount of that being done. What's really critical is we're learning now, if you look at the statistics, China actually has lower mortality than the US from coronavirus 19. And it's interesting because, again, how were they able to stem that death rate very quickly? And they actually had an overwhelming, beginning. It turns out vitamin C intravenously is part of their basic protocol. So in addition to some of the drugs we've been talking about that people are now starting to use, hydroxyquinoline and Zithromax, vitamin C is part of the basic protocol. What's interesting in their studies is actually as soon as people got admitted to the hospital, even with mild cases, they were often given intravenous vitamin C. The most interesting part of the whole thing, they had a lot of trouble doing trials because no one wanted to take placebo. Everyone wants to be treated. Right. Listen, from my point of view, I wouldn't want to take placebo.
Yeah, of course. And especially in the respiratory, with people with respiratory symptoms, right? The chloroquine was administered 500 milligrams twice a day for 5 days, and then it went down. They actually titered it.
Correct.
And then they also gave the vitamin C every 6 hours for 4 days.
Right. And what they were giving is actually 1.1 grams. So it's not a lot. I actually train with 20 to 25 grams at a time.
Me too.
That's what we give.
Me too.
But what's interesting about it is my journey through this really started 5 days ago. I've been bugging Nigma over every day. I think she'll turn her phone off soon. So
no, I'm finding it fascinating. I think it's. I thank you so much for bringing this protocol to my attention, because I've been forwarding it to everyone, every practitioner I know. It's just, I think it's important information to have. It's not going to hurt to put people on vitamin C and vitamins during a time where we don't really have any answers, and we want some kind of comfort to know that there is something out there that could be beneficial.
100%. And what's interesting is it's not new studies. So when I went and did some research, it turns out for sepsis or septic shock, and what that really means, these are the patients that are so sick, they end up being hospitalized. So this is your sickest group, and often end up on mechanical ventilation because they cannot breathe effectively.
Okay.
And what was interesting, they found, and this is the one study that was done by Dr. Tumeric, that he took a group of people, and if they gave vitamin C really within the first 6 hours of them entering the hospital, mortality dropped from 40% to 8.5%.
That's hugely statistically significant. So, I mean, I know I've been giving intravenous IV drips. It's called a Myers cocktail, for those of you who don't know what it is. It's not a drink. It's a combination of magnesium, vitamin C, B complex, and you can add different things. You can put like L-carnitine in there. You can put trace minerals. But generally a Myers is just C, B complex, magnesium, and that's it. And it's a great cocktail. I used to give patients who were feeling they were coming down with something or they were traveling. And I would honestly say, whether it's placebo or not, 99% of all my patients say everyone on the trip got sick except for me because I did the Myers before. And, you know, also if you want to do it when you come back. Now, is everybody able to do that? Maybe no, but, you know, oral doses are also really good. And I really like the liposomal technology for vitamin C because I find that is absorbed more. You can take more of it without.
And that's so critical because one of the problems is because our gastrointestinal system, it works the way it does. A large amount doesn't often get through, and that's one of the challenges. That's
the challenge is the oral, but still the oral is effective. I do find, you know, people that do take oral levels of vitamin C every day they feel better. It's also good for collagen production for the skin. For those out there listening who are into skin, I take vitamin C regularly every day, and it's amazing for collagen production. It helps with white blood cell formation. So, you know, and also in this particular case, I think it's working as a primer. You know, as you and I were talking, like, how is it allowing the steroids to actually get into the alveoli to help reduce inflammation? Right. So it's interesting.
So if you want me to talk about why there's been a controversy, I think that's always interesting.
Yes, I'd be interested.
So the controversy came about, there was this large study done that was called Citrus, appropriately, Ali. So there was 211 patients. They looked at it. So they looked at the scores, and it's called a score based on organ failure. Right. And actually what happened is they miscalculated the scores. So when they came up with the results, it said that as a primary outcome, which is the main outcome they looked at, that vitamin C had no impact. But by the way, as a secondary outcome, less people died. So to me, that's kind of the primary outcome.
Well, yeah, I think that's more important than, okay. Yeah, I remember us talking about that particular study.
So to me, that's the primary outcome. Even more importantly, just released within the last 3 or 4 days was a study that was a meta-analysis. What that means is they look at multiple studies together and join the results. And this was almost 700 patients. And they found, on average, given 1 to 6 grams of vitamin C a day intravenously, decreased ventilator time by 25%. If anyone watches the news now, what's the word that's number one word? We don't have enough ventilators. We don't have enough ventilators. And the problem in COVID-19, as opposed to our experience, which is really influenza, is that COVID-19 patients are often on the ventilator from 10 to 21 days, whereas our typical previously influenza patients were 2 to 4 at most. So we're having much, much longer stays in the ICU, much longer times on ventilators, really leading to a great shortage of equipment for sick patients.
So that brings me to the question. This is a different beast. I mean, this is not the influenza. I think when this first started, a lot of people were comparing it to the influenza virus. I don't see really a lot of resemblance between the two because there's no end of this virus. There's no like shut door mechanism. It seems to just go on and create a cytokine storm and create inflammation. And we're now looking at this as potentially like an inflammatory, I would call it an inflammatory virus where it gets in. Sure. It's the virus that affects it. It's what the virus does to create, it's kind of like a shit disturber, for lack of a better word. You know, it comes in and causes a huge ruckus, makes everyone upset, inflames the whole body. You know, we have these cytokines that get, you know, like IL-6, TNF, you know, they're all sort of firing balls at each other, kind of like, you know, one ball at a time, whereas there's like we call it a cytokine storm. Tell us about what is.
So if you want me to explain that, I'll happy to. So what's interesting is one of the problems we're running into is we're really treating people based on influenza data, right? But if you look back, we've actually had a coronavirus before. If anyone remembers SARS. SARS actually happens to be a coronavirus. And there was another one, it was called MERS. They have these interesting 4-letter names. So it turns out in both cases that they're much more inflammatory than we deal with influenza. So one of the challenges, again, it's the virus that doesn't really kill us, right? The virus replicates, and you see on TV, 80% of people recover pretty fine. But it's that 20%, or you know, even that 2% that's really, really sick, that the inflammation overtakes the body. Ironically, it's our own host immune system that attacks us. Yeah. So what's interesting is Nigma started mentoring 2 main cytokines, interleukin-6 and necrosis factor alpha. So what a cytokine is just another word for inflammatory cells. So inflammatory cells are good in one sense, right? When you cut yourself or you have a sore throat, you want some kind of inflammatory reaction. You want it to end, though.
It doesn't.
And when we think of chronic disease, right, people talk about autoimmune disease. That's a chronic inflammatory syndrome.
Yeah.
So one of the things is you want to control that, what we call cytokine storm. And interesting enough, that's actually what hydroxychloroquine and Zithromax work. You know, people are probably saying, why are we giving an antibiotic for a virus? Right? I mean, well, interesting enough, it's actually anti-inflammatory.
Exactly.
So we're actually not using it as an antibiotic, we're actually using it as anti-inflammatory. And the other part of that is there's a lot of controversy about ibuprofen, Motrin, and other non-steroidals. There is a concern that they actually can promote inflammation, that they, in the outskirts of the body, they can increase these cytokine levels. That's why we're trying to limit people's use of it because of that aspect. So vitamin C also works that way, and steroids work that way, but you got to be careful about steroids, and this is the caveat. In mild cases, you don't want to use steroids because that inflammation process isn't so bad, you don't want to increase the virus. So in a mild case, you can actually make it worse.
Right.
It's the very, very severe cases that you want to use it.
I think that's key. I think that's key because people are like buying the hydroxychloroquine and they're just like, I'm keeping it just in case. And it's like, that's if you start to get respiratory issues. We're not entirely sure. I don't know if I would start that drug if I started to get that symptoms because it has so many side effects. We still don't know about how.
I think that's clear. I think, again, it's very, very good point. And I think that's very clear. Again, remember, this is, and Nigma and I were talking about this the other day, we're all trained in hospital-based medicine, right? We're trained in double-blind studies and a protocol. This is, I call field medicine. This is out in the field. I mean, I remember when I was trained in the mid-90s, when I was in the village during the HIV epidemic, there was a time when we didn't know what worked. We didn't know what medication. We didn't even know what the diseases were that came with it. So, again, I think we're faced in that same kind of environment. We're really working behind the 8 ball, where we're really learning as we go along what works and what doesn't work. And again, my feeling about that is you always want to try things that actually have low risk, right? And the great thing about vitamin C, can I bring up another protocol? There was one done at the VA in Memphis. They showed only a mild benefit. And sometimes the reason that happens is in often cases, if you give it too late in someone who's seriously sick, nothing may work. So there's really a time dependence. But their final saying was, it didn't do any harm. So if something doesn't do harm, I want it.
Why not? Well, and it's cheap. It's relatively cheap as well. And hospitals are able to get it. So, if they look at the Dr. Tumeric program, protocol, that would be an interesting thing to see happen. Let's see if we can make it happen, right?
Well, the good news, since you've been saying that, we've probably added about 10 more hospitals around the country now are doing it. And I've learned that in Italy, now they're doing it in some places. Someone was telling me in France, they're actually suing the health ministry over being able to do it. Okay. That they've been blocked from doing it and they're actually going after. But in China, again, that's our greatest resource. Remember, this started there and they're survived this. They're in the recovery phase.
They're totally recovered, almost.
And that should be our basis of treatment.
I agree. So, with all of this being said, people are at home, and you recently wrote this amazing article. It's called Need Healing, Chicken Soup, a Universal Remedy, which I've always been a huge fan of. So I dug up this article it's in Forbes Life. I'm going to post the recipe and on my Instagram story. So if anybody wants Dr. Berkowitz's chicken recipe.
By the way, it's my grandmother's, not mine. So it's actually
good. Sorry, not yours. It's your grandmother's. He never made it for me when I was there last, sadly. But our good friend Judy Jew, who is going to be joining me next week, Judy Jew is a chef, and we're going to make chicken soup live on my Instagram. We're going to do this sometime next week, so look out for it. And we're going to make a chicken soup that she always used to make me when I was under the weather when I lived in London. So super awesome recipe.
Should we talk about why it works? I mean, I think that's...
Yeah, of course I want to talk about why it works. That's why I brought it up. I'm really excited. Why don't you tell me about your chicken soup and why it works?
So chicken soup actually has large levels of cysteine.
Yes.
One of Nigma's favorite supplements is N-acetylcysteine.
Yeah.
Does anyone know why? Okay, I'm going to tell you. N-acetylcysteine helps your hair grow.
Yeah. It also, I mean, it's good for so many things. It helps increase
Right.
glutathione levels, which I'm a big fan of glutathione.
And again, it's actually used in hospitals today for Tylenol toxicity. It's really kind of interesting. Right. So it actually works by that way in increasing, as Nigma said, glutathione. And glutathione is another substance that acts very similar to vitamin C and actually helps increase vitamin C levels in the body. So what's interesting about that, it also acts as what we call mucolytic. So mucolytic in itself is a process what helps you get up mucus, right? When people have infections, one of the big problems is all this mucus develops in their chest and they're coughing and coughing, but they can't get it out. So a mucolytic is a very effective way of doing it. What's also interesting is the heat aspect of hot soup works as well too.
Yeah.
We're beginning to learn more and more about this virus. And again, chicken soup is not a cure, but the virus actually does not like heat. I was watching, they were talking about the curve of the virus, and a lot of people are talking about, they think as we get into the summer, the virus is going to disappear because of both UVB light kills virus and also the heat. And that we may actually have a recurrence in the fall, which is really scary. Hopefully by then we'll start to build up some immunity and it won't be as problematic. So that's actually really effective. And then if you add colorful vegetables and stuff, they act as phytonutrients, and they can also be effective as well in helping your immune system work better.
So, but the World Health, just to interrupt you, the World Health Organization said that the temperature above 56 degrees Celsius kills the SARS coronavirus 19 at around 10,000 units per 15 minutes.
Wow.
So it's a pretty quick reduction. So heat does. So I mean, it'd be interesting to see if the weather, maybe people are going outdoors more. They're not staying indoors and, you know, now.
Well, if you think about any kind of virus, right? Typical virus seasons are in the winter, right? Really by April, it starts to really die off. You really don't see it again until really October, November again.
So can you tell us what your grandmother's recipe is?
I don't remember. You have it in front of you. Is it in there? I don't think it's in front.
I have it in front of me. I'm going to post it for everyone, but we'd love to take some questions. If anybody has any questions, Dr. Keith Berkowitz is like, literally, he is a fountain of information. There's endless amounts of, he loves answering questions. So please, if anyone has any questions, let me know now. We'll be taking question and answer, and we'll do a Q&A. But this recipe is super cool. I'm going to try it myself, and I'm also going to do it with Judy next week live. She's going to do all the chopping and cooking.
So and you definitely don't want me near any chopping device. We know my history. So
definitely not anywhere near chopping devices. But we're gonna add like things like turmeric. Turmeric is a curcuma longa, is a natural anti-inflammatory. So really good to add. In Indian cooking, we add it to curries all the time to make that yellow flavor, that pigment. So I add that to everything. And I also make like a turmeric golden latte. It's my little treat that I make every day, and it's just delicious, and it really just soothes the mucous membranes. And you know, right now is allergy season here, so there's a combination of people like feeling like they've got allergies and this whole fear about the virus. So there's other things that are going on beside this coronavirus, and I think you talked about quercetin is massively important for stabilizing mast cells.
Right, and acts as what I would call a natural antihistamine. So it's really important. It has a mild antihistamine effect. I mean, again, I think that brings such a great point that, you know, about taking care of yourself is so critical that when you are weakened from something else like allergies or some other process, it really puts you at higher risk. Again, the more issues you have, the higher risk you get. And I think one of the problems I'm seeing in my practice is people struggling to survive being cooped up in the house. And I actually have a great piece of advice to start for people.
Yes, tell us.
Keep a schedule. I think we're very animals of routine, and we like having a schedule, right? So we want to, and again, by keeping a schedule, you make sure you do get your exercise in. You make sure your meals are actually structured, that you're not eating all day and grazing because you end up having more because the refrigerator is right nearby. You know, you take a walk. You make sure you get proper sleep. This is a great opportunity, probably better than we've ever had before, to really take care of yourself. I mean, we live very busy lifestyles. But now actually because of social distancing, the sense that we have to be at homes, to flatten the curve, this is a great opportunity to really improve your health.
What's your routine in the morning? Can you walk us through your day? Like, what do you do when you wake up?
Working day
Besides
or working
call
day.
me. Besides call me.
The problem with calling you is you're 3 hours behind me. I have to wait.
I know. You're calling me at your lunchtime, but what's your routine? Like, what do you like? What is your? Because I've created a routine. What's yours? I'm curious to know.
Okay, so I have two different types of days. I have
and
days
you
when
have
I'm going to
4
the office.
kids as well. You have 4 kids, so we need to
I
all
forgot
take
about
that into
those.
consideration.
So mine's different depending on whether I'm home or not. So days that I'm going to the city, I always actually, where I would take the subway, I would actually walk for 45 minutes to the office. I go to the office 3 or 4 times a week now. So then I would, before I see patients, I would always make sure at the end of the day and the beginning of the day, I would take a walk. So that gives me at least 45 minutes of exercise. The other thing is I would make sure I would have structured meals. So I would eat at 8 o'clock, then at 1 o'clock, and then have dinner at 5 or 6 o'clock and keep that routine. Because I think by not having that routine, your body falls out of sync. Are my days not in the office, which is today, Wednesday, I actually get up in the morning, I take a walk to start the morning. Then I go to the supermarket. I really find going at 8 o'clock in the morning, much better opportunity to do food shopping.
Right.
And the advantage is you're around less people. So that's really important. And also, I want to make sure we have healthy food to eat, things that are fresh and everything else, so that we can make really balanced meals. Because it's really important to eat proper meals, to get proper exercise. Again, we don't have our gyms right now. We don't have the ability to eat out. So really, stuck at home. But the advantage is we can cook for ourselves. We can prepare proper meals. We have time to take a walk or exercise if you have gym equipment, or even learn through Zoom or other opportunities. It's really amazing. And the best part, spend time with the ones we love in our family. We get really good opportunity to really bond and talk. I learned that my 17-year-old boy does talk. Didn't know that before. So we're able to converse. So it's been a great opportunity for that.
I was talking to a friend yesterday, and she's saying like her son is more, because she travels a lot, and so she's like her son is like holding her hand more and spending more time with her. Like I think this time spending with your kids, I know it can be tough because it's 24/7. I mean, you're going to the office right now and seeing patients.
Yes.
So you're still going into Manhattan, into the epicenter of this craziness. What's it looking like over there?
But again, we all have to use proper precautions and be careful. But again, the better you take care of yourself, that is the best defense you can provide. And
so you're like wearing
full
on gear. So you're wearing full on like mask and gloves and.
We actually are not in the city because we don't want to take it away from the healthcare workers in the hospitals.
Okay. And what's it looking like when you're walking to the office? Because I know I used to work in that building with you. For those of you who don't know, I practiced in the same, the office next door to Keith's when we were working together in New York. What is it looking like there from what it normally looks like?
The city's empty. I would say it's about 85 to 90% decreased in traffic on the street. Most of the restaurants are closed. Most banks are closed. We were just talking today, getting a haircut is impossible. So we're stuck for that for a while. And again, it's very quiet. It's a little eerie.
It's a bit eerie. Yeah, well, I need to figure out how to, I saw this one thing. It's how to cut your own hair. So it'll be very interesting to see what that looks like.
I'm going to stay away from that one for my own safety and everyone else around me.
No, that's, it's interesting. And so what kind of patients are you seeing right now? Like who's coming in?
Well, I'm really trying to, again, I'm not seeing anyone who's acutely ill with symptoms that are flu-like with fever or chills. But what I'm more concerned about is people who don't have those symptoms. They hurt their back. They have a urine infection where they should not be in the hospital and be safe. And on top of that, I've been managing 5 to 10 patients on a time at home with, mild to moderate symptoms. Just because I wanted to keep them away from the sicker and exposure-wise. And what's interesting about this, and I think what's scaring a lot of us, is they're maintaining fevers for much longer time. I had one patient that literally had 103 fever for 7 days. Yep. And that's typically what would scare us, but we know that's not so different from this virus. The other thing is people will go down to normal and then spike back up. Or during the day, they'll be fine, and then in late afternoon to evening, they'll spike a fever as well.
even I'm seeing in patients, so I'm seeing a lot of patients with the COVID-19 via telemedicine as well. And I'm finding that they're also getting low-grade fevers, headache, not getting the full-on symptoms that everyone's getting. So, if you are feeling sick or feel like a cold, best thing to do is stay at home and do some telemedicine with your naturopathic doctor or your integrative doctor, like Dr. If you're in New York, definitely, go and see Dr. Well, don't go and see him if you're feeling like you're more than welcome to send him a message, a DM on Instagram. It's Dr. Keith Berkowitz. And it's on my Instagram, his Instagram page, for lack of a better word. I was like, what am I saying? His Instagram page. So follow him, send him a message. Keith, do you know how to check messages on your Instagram?
I'm going to ask my 9-year-old. I think he'll figure it out for me.
Because people are going to have some questions. I know we didn't get any questions now, but like if you want, you can DM us and ask us questions.
I saw one about the skin. I actually saw someone post about how do you take care of your skin during the quarantine.
Okay, sorry.
That I'm going to leave for you.
Okay, you can leave for me. Okay. That's actually a good question because you now have time to really take the time to wash your skin. So people really don't put enough, people rush out the door, including men and women. Washing your skin right now is super important because you want to get all the overgrowth of bacteria. You're staying indoors mostly, so your sebaceous glands are going to increase more. So cleaning your skin, number one, is super important. Getting on a good cleanser, alpha hydroxy cleanser with salicylic acid, glycolic, that's going to help increase the skin turnover and it's going to make your skin look brighter. And then anything you put on top of that is going to work super well, like a serum with a hyaluronic acid serum and a cream. And of course, because we're washing our hands so much, our hands are also going to get dry. So you can use the same thing with your hands as using serum on your hands and cream. Maybe a little bit of an expensive way to do that, but just get a straight hyaluronic acid. Hyaluronic acid is increased absorption into the skin. I would not use any oil on your face. Oil is very congesting. It congests the skin, and our skin makes our own natural oil. So there's no need to use oil. I also have some really good do-it-yourself face masks in my book. I don't know if anyone's read my book, Younger Skin Starts in the Gut. There's some awesome do-it-yourself face masks with avocado. Keith, maybe we can do one day. I can get you to make.
You better show me to do it. Maybe that will be our next Instagram Live.
I think it should be our next Instagram Live. Like, so it's like mixing things like avocados and egg whites and yogurt. Although I don't let people eat the dairy, it's really good for your skin because of the lactic acid in the yogurt, which actually brightens the skin. So there's a lot you can do to take care of your skin at home. Also eating healthy. So we know your face is a reflection of what's going on in your gut. So if you're having breakouts or redness, you talked about this at the beginning, Keith, is how, everything starts with your immune system in your gut. Everything starts with, once you find the root cause, which the root cause is almost always in the gut, you resolve everything, right? So somebody has a rash, somebody has eczema, somebody has chronic ear infections. Where do we go? The gut.
Well, and I think you're making a good point because people are still going to have these issues all the time. So just because we're in quarantine doesn't mean you don't take care of these issues because these are chronic issues that people will see all the time, no matter what. So again, another point from that is your normal medical issues should not be ignored. And that's really important that you take care of yourself like you would when you're not quarantined. If you have diabetes or heart disease or issues with allergies, those things still need to be dealt with during this period of quarantine as well.
I've got Queen Millie. I've just been eating a good breakfast and a big lunch and smoothies for dinner. Okay, great. Whatever you feel. I mean, I think the thing is people are also starting to overeat because they don't know what else to do. Like they need to social distance themselves from the refrigerator. Because it's
6 feet from the fork.
Yeah, exactly. I think that's super important. And what people don't realize is like, yes, you can put topical stuff on your skin to make your skin feel and look better, but the real thing is coming from what you're eating. you know, what foods you're eating. If you're eating
Can I comment on the dinner?
Yeah.
I actually want to comment, so I want to bring it to the point. So it was Queenie who said it? It was really great.
Queen Millie. Queenie Millie.
Queenie Millie, thank you. So what's really good that you're doing is that you're actually having a small dinner. So the advantage to that is allows your body to finish digesting. What people forget is if you finish digesting, your body heals overnight. Guess what heals overnight? Your immune system. And a lot of times we don't get better because people are digesting overnight and their body's really not truly resting. So I really think that plan really is really effective for people. Having a small meal at night is really good, letting your cortisol levels drop, letting your body heal, and allowing your immune system to recharge itself overnight.
Well, because when you're eating food, all your energy, your enzymes are literally what 2.5 liters of enzymes are produced from when you eat, and how much of that energy is taken up by your body. So a lot of the part of that, having a light meal at night is perfect. And having a big breakfast. Actually, this intermittent fasting thing, that's another thing we should talk about on another call, Instagram Live, is this intermittent fasting. I've noticed on my patients, it's not good for people who are burnt out. It's the worst thing you can actually do.
Well, one of the problems with it is that people, and we can talk about this some other time, is the thyroid is food dependent a little bit. So you got to be careful.
Exactly. This is why I love talking to you. Okay. How do you decrease symptoms once you have symptoms or are diagnosed with the COVID-19?
I guess that's for me.
Well, we can both share this. Go for it.
So again, you know, there was a protocol we discussed in the beginning with Dr. Tumeric where he used a combination of things like zinc. They used quercetin, vitamin D, vitamin C, and melatonin seemed to work together to help prevent the virus from spreading or getting worse.
Also, the key is...
And maybe we can post the... Yeah. Would you like... You can post the protocol, actually. If you want to.
I'm going to post the protocol, double O Young. We will post this protocol so you can have a look. You know, if you're fairly young and healthy, I mean, listen, it's what it's doing is it's survival of the fittest. I hate saying that, but it's like this virus is attacking unhealthy, older, you know, populations, and because of that whole inflammatory cascade, what we can do to do our best on our end is definitely, you know, monitor your symptoms, make sure you're eating really healthy. The chicken soup is key here, you know, hydrating, keeping your electrolytes in check too, because if you're getting fever, you're going to lose those electrolytes, which can make you feel more sick.
And actually, dehydration is one of the main reasons why people actually end up getting hospitalized. So
exactly.
That's one of the keys.
So keeping, you know, when you're using the natural electrolytes in the soup, with the chicken soup that you were talking about, your grandma's chicken soup. That's a really good way.
And I like, when I talk about food, I like the term nutrient dense, easily digestible foods. That's a great way to think about it. I love
that. That's actually a really good way of saying it. And nutrient rich. And, you know, just keep your symptoms, you know, make a note. If you start to, I mean, these are the known facts that we know, Keith. It's like if you start to get shortness of breath, that's the time to call your doctor.
Yeah, a lot of people feel that their chest is on fire is one of those symptoms where they can't breathe. Really, the most important thing is really when the respiratory symptoms get worse. That's really need to communicate with someone, or if the fever is not going down.
Right.
Again, it's really important to stay in touch from communications. Is this way you can stay ahead of it.
I know.
And I'll bring another point about that. One of the things that's happening is that a lot of people think that sometimes the deterioration is 6 to 8 days after the virus symptoms start. So it may not be day one, so you have to be careful to monitor that carefully.
I'm in Madrid and thousands of people have gotten it being totally healthy. Absolutely. This is not about not getting it. I think 60 to 80% of the population, we've been told, is had it or going to get it. It's just how you react to it when you get it.
And the sickest people are the ones that, you know, with the most complications tend to be the people that have the worst outcomes. So it's really important. And again, that's why actually staying at home is so important. It's not yourself necessarily. It's your grandmother, your grandfather, your friend who survived cancer, who has diabetes, who has heart disease. Actually, the largest group with mortality is actually people with heart disease. They think as much as 10% of the people that are dying from this disease are because of heart disease as an underlying condition.
And again, they could be on ACE2 receptor, those ACE2 receptors, they can be on the blockers. So that could reduce their ACE2 receptor amount. So that can also be part of the increased risk. We don't know. We're just finding, I guess, all of this out, right?
So they asked the question about the viral amount that gets into your body.
Good question.
So what it is we started talking at the beginning, there's something called an ACE2 level that gets in. So the virus literally, I was thinking the word before, hijacks. That's the word I was looking for.
Oh, that's
hijacks
the word.
The
yes, it hijacks.
So it doesn't work. and that happens. So the more you have of ACE2 levels, the more protected you are. And actually, the good thing about being a woman is women have higher levels of that.
Okay.
I don't know about Prevotella. So do you know, Nigma?
No idea.
With Prevotella?
No idea. I've not seen any connect. I have no idea.
Yeah, Eve, I'm not sure why that is. So I've not heard of that before.
Any other questions? So yes, it is going to be in 60 to 80% of the population. That's what they're saying. So, some people will get through it in 2 days. Some people will take them 2 weeks. Some people have a really bad reaction. It's all over the place. And the more of the data, as the time goes by, we'll see more of the data come in. But what I love about this Tumeric protocol is that it's being used already, and they're starting to use it more in hospitals. So I'm going to post that protocol definitely on my Instagram for people who want to know.
And actually, could I give a little? So one of the things we were doing is really from an advocacy standpoint to really make people more aware of why it's important, and that intravenous vitamin C is a key part of it, and
right.
that is a great start. And again, when we're physicians, we take an oath to do no harm. So I think it's really important to consider treatments that do no harm first. And again, this is field medicine. This is battlefield medicine. We really need to start doing things more aggressively and look at all options, because
look at all safe options. We're not sure if it's effective. We don't know. We've seen studies that have shown it's effective, but it's not going to do any harm if we are being faced with such a large amount of people being in hospital on respirators. And if we're seeing a mortality rate go from 40% to 8%, I think that's statistically significant, and we should be talking about it. We shouldn't be scared to talk about it. We should be able to say how we feel, especially when something is safe and effective and is widely available. So,
and we'll post the questions about the supplements. We'll post Dr. Merrick's protocol.
Yeah, and again, guys, these are all Dr. Merrick's protocol. This was actually, in his protocol. These were studies that were done. We don't know your particular case. Everyone has unique case. I mean, I'm dealing with 3 patients right now via telemedicine with COVID, and all 3 of them are completely different. It's incredible. So, and they have been diagnosed with COVID-19 by getting the test done. So it's, everybody is different. But again, what does melatonin do for it? Again, we know melatonin is an antioxidant. It's produced in younger individuals more than it's an aging thing. So I don't know, Keith, do you want to?
It does. Your immune system is dependent on melatonin. It definitely has an immune process, and what it does is it leads to better what we call apoptosis, is really getting rid of debris, cellular debris, and that's really important. A lot of toxicity people get when they get very sick is because the cellular debris is not able to be cleared out.
I just what I found when I researched melatonin, it's able to actually shut down the inflammasome, which is highly pro-inflammatory. So it's been able to look at cytokines IL-B and IL-B beta.
Right, which is a precursor to interleukin 6.
Exactly. So this is a research that I looked at, but now this was done on endogenous melatonin. So we're not sure about supplemental melatonin.
But I know in the very sick, they are using that in the ICU as part of the protocol.
Yes.
But also,
hi, Tacha. Hi, Natalia.
It also
Natalia
is helpful.
from Madrid
sleep
is here.
is critical as
Sorry?
well. sleep is critical part of this as well.
Exactly. Sleep is super important because if we have enough sleep, we wonder what our endogenous melatonin levels are going to be. It'll be very interesting to know that. But that's the research I did. And also the pregnant women had higher levels of melatonin. That's really interesting. It's almost like the body has like a protective mechanism where it produces.
And one of the things about melatonin, when your cortisol is very high, that's you actually have lower levels of melatonin. And melatonin on the other aspect can help lower cortisol levels. Again, I think in this time frame, most of us probably have high cortisol levels. It's very important to balance that out better.
Take care, Natalia. She has, we have Flavorful Fit saying, I haven't been able to sleep from stress. Okay, and we understand that. I mean, I think the key is what you were saying, Keith, is to have a routine. You know, I think that's super important. And meditation also has been shown to really help balance your cortisol. That's been scientifically shown in a lot of research papers. So, you know, shutting off your brain, not watching the news constantly all day, maybe watch 10 minutes of it and then, you know, figure out what's going on.
I think the hardest part is we have so much information coming so quickly and not consistent. I think that scares a lot of us. And I think, remember, again, we think about what you can control and try and control that. What's happening tomorrow, the unknown, we can't control that so much. And so, again, you got to try not to worry as much about it. It's more easily said than done. But again, by controlling your schedule, controlling your patterns, your family, exercise, proper eating, all those things really are effective. Meditation, all those are great.
Natalia from Tatra Beauty said meditation and pranayama is very good. Awesome. We do have to work
and we
on
know that watching TV at night lowers your melatonin level.
Have you heard of the Headspace app?
Me?
That one is a good app for meditation.
Yes.
And breath work as well lowers cortisol from Justine Master Skincare. Absolutely.
And I like an app I use sometimes called Heart Math that goes on your iPhone that I think is also very effective to get your breathe. Heart Math. Heart, like as a heart, and HEARTMATH. What it does is it trains your body to get your breathing and heart rate in sync, and that helps lower cortisol as well too.
Yeah. No. Again, the whole cortisol connection with causing immunostimulation issues is huge. You know, like you haven't slept in days, you're going to have problems with your immune system. You end up getting sick. You know that when you're studying for exams and you're not sleeping, and then as soon as your exams are over, you get this really bad cold. We've all been down that dusty road, right? So it's all
Correct.
about the cortisol connection. Super, super important. Anything we can do to manage that, meditation, you know,
tapping for sure.
Tapping for sure. Yeah, all of these things are great. Oh, Dr. Berkowitz, I love you. I love talking to you, and I'm so lucky.
I feel like I'm right next to you, even though we're on opposite coasts.
I know. Well, we talk every day, so it's like it's great because you know the two of us are, you know, we want to work together to see what we can do for our patients to help our patients optimally. And we're both doing patient consultations right now. You know, I've got full days seeing patients virtually, and although I don't get to see them physically, you know, it's really interesting during this time to be able to support our patients and let them know that there are options for them to keep their immune system healthy and their eating habits on track.
Thank you so much for having me.
Thank you. Thank you, guys. This is my first Instagram Live. You guys are going to be posting much more. The people that are going to be on our Instagram Live, we have Judy Jew, Carlene, Gaetano. Thank you. She says, you guys are amazing. Aw, thank you. You sharing your brilliance together. Queenie, Millie, thank you. Okay, guys, so we will see you. My next Instagram Live is tomorrow, and we'll see you then.
Thank you. Bye. Have a good night. And be safe.
You too. Okay, you too. Bye, Spain. We love you.